Hi, I'm Matthew Byrne, an anatomy demonstrator at Cambridge University. I'd like to share with you some of the changes that our department's made to the teaching that we deliver to first-year medical students. Before COVID-19, students would perform dissection, and this was supplemented with virtual dissections. Now we've uploaded these virtual dissections online using touch-of-life technologies and included a guided learning plan for each dissection so that students can perform virtual dissections on their own as self-directed learning. We've covered all aspects of anatomy that our medical students need to know, and we've split these down into three main domains: functional architecture of the body, the abdomen and pelvis, and head and neck, and this mirrors our curriculum. Let's have a look at the neck and thorax. Here you can see how we've broken down the anatomy into separate tutorials. Students can choose to work through the tutorials in order or do them each individually. Let's have a look at one of our tutorials, the mediastinum. Students can follow the guided learning plans we've created and use the tools available to see what they're looking at. They can use the dissection tool to remove areas so that they can perform their virtual dissection. In our learning plans, we guide the students through the areas that they should be focusing on and include their relevance to anatomy and clinical medicine. We've given access to this to over 300 first-year students and their tutors. This supported self-directed learning means that our students can continue to learn anatomy despite the disruptions due to COVID-19. Thank you. We hope that this inspires others to do something similar.